Hey everybody, this is Ryan coming at you with this week's Tuesday tip. All month this month, we're going to be talking about patient retention. And this week specifically, what we're going to be talking about is how you can utilize hard data to start to proactively monitor engagement within your facilities and improve patient retention over time. Everything that we do is within the vein of this patient relationship management process. Today, our focus is going to be on that middle slice. Again, how can we take data both at the organizational level and at the therapist level and give it to the right person at the right time so that they can improve the experience for their patients? So at the organizational level, what we want to give you the opportunity to do is take all of that Net Promoter data that you're collecting. And if you're unfamiliar of what the NPS is or the Net Promoter is, head back into our blog and kind of look through some of our posts on Net Promoter to get an idea of its value, specifically in physical therapy. What we're looking to do is take that information and aggregate it onto a dashboard for somebody like a business owner or a practice manager to be able to access and understand where their company is succeeding and where they might need a little bit of help when it comes to the patient experience. So as an example here, this is a Net Promoter dashboard that is on StriveHub Reach, where an owner can come in and look at their overall Net Promoter score, but then also start to filter down to see how things are going and why they're happening. So what we'll do is we rank Net Promoter score by physical therapist or by provider so that you can see which of your providers are on the high side versus the low side. We can rank by location. So if you're a multi-location group, you can break it down that way. And then also by body part. So when we're mapping those diagnosis codes to body part, we'll be able to show you NPS by body part. And then based on this high-level data that you're getting, you can start to do things like say, okay, you know what? Let me look here at my Boston clinic. They're right in the middle. They have 36 responses. Let me see how that's shaking out and why it's shaking out that way. So I'll come into my location filter and click my Boston clinic. And now all of a sudden, this is just the Boston clinic data. And as we scroll down, we start to see NPS by provider. And here's where you can see, all right, it's pretty clear that Ryan Kleps as a provider at the Boston clinic he's a 0, whereas everyone else has a high score. He's kind of dragging down the scores. So let's go into provider filter and just look at Ryan Kleps as a therapist. So we do that, and now this is just Ryan Kleps's data. Again, now it's a 0 with all of Ryan Kleps's most recent responses. So you can go through those recent responses and tag them with trends if you want. But what's really powerful is being able to come down to Net Promoter by body part and seeing sort of where Ryan is doing well in terms of the patient experience and where he's faltering, like the knee, the thoracic, and foot. Now, all of a sudden, you have actual hard data rather than, hey, I feel like you're having a little trouble here. You can actually sit down and have a really proactive conversation based on the data that you see, and then over time, track how those conversations and those process changes that you're putting in place are affecting your NPS scores over time. And the beauty here is you can do this at the organizational level, and just 1 or 2 people at your business can manage this dashboard and understand it at a deep level. What we also want to do is give each of your therapists the ability to monitor how their patients are engaging within their course of care. So within StriveHub Prescribe, which includes exercise prescription, you can also monitor those patient data points. So if we click from the exercise module into our patient module as a therapist, what we see is, okay, here are, out of my active patients, I've created 10 care plans over the last 30 days. And overall, unfortunately, only 10% of my patients have logged in. It's much higher than that. It's usually about 50%. On average, 1 login per patient, and my Net Promoter score is a -15. So you're getting high-level statistics for an individual therapist, but then that therapist can also quickly scroll through their active patients and be able to see who's a detractor, who's passive, and who's a promoter. And then utilize some of this other data as in how they're interacting on the patient portal and use it right within their clinical care. So they can look at somebody like, Keegan here, who's a detractor, who has never logged in, never tracked workouts or sent messages. now have the opportunity to click into Keegan's name, look at some of the past exercises that they've prescribed for that patient, but also go ahead and say, all right, if this person isn't engaging, let's facilitate that engagement. Let's send them a message that we're going to shoot right to this patient and say, hey, feel like we haven't gotten off on the right foot or something like that. Essentially, giving them the data to understand which of their patients might be at a high risk of dropping out, and allowing them to intervene appropriately at the one-to-one level. All in all, what we're looking to do is provide therapy clinics with the types of data that they need to manage their patients in a more effective manner, specifically when it comes to patient retention. If you have some questions on any of this, because we did sort of go over a lot today, feel free to reach out to me via email, ryan@strivelabs.com. Twitter is @rklepsdpt, or you can reach out to the Strive Labs team at strive_labs. And be on the lookout for next week's Tuesday tip. We'll continue to focus in on patient retention and how you can utilize StriveHub to make sure your patients stay sticky within the course of care. All right, talk soon.